Nepal's capital of Kathmandu is in lockdown, and its hospitals are struggling to cope with the surge in people infected by coronavirus.
Our emergency room had 5 beds, but now we have 25 beds. We have added 20 beds in our emergency room. Until now, we have not returned anyone from here without providing them with oxygen, but the situation is getting complicated.
Near the border with India, more workers from Nepal are arriving home from Indian cities stricken by COVID-19, and that's adding to the health crisis. Staff in hospitals are forced to turn away patients as beds and medical supplies are in short supply. And many cremation sites are filling up as families say goodbye to their loved ones from a distance. Northeast of Kathmandu, an increasing number of climbers arriving for the spring climbing season on Everest are testing positive and being evacuated.
We try not to mingle. We used to have a lot of fun at base camp and would sing and dance, but we're not doing any of that now, and we're only speaking to those in our teams.
With the coronavirus outbreak in neighboring India growing, Nepal is suspending international flights, and travelers like RAJBANSHI are rushing to leave.
I'm very lucky to be able to take a flight on the last day of them operating. I'm so glad I'll be able to leave Nepal, where COVID-19 is getting really bad.
Domestic flights were also halted earlier this week, and the government has announced other measures to curb the COVID crisis. They include finding more space to store the bodies of COVID patients who've died and diverting oxygen cylinders from industrial use to hospitals. Funds are also being allocated to build oxygen plants, and lockdowns in and around Kathmandu are being extended by a week. But health experts say all this has come too late, and the Red Cross is warning that Nepal could face a worsening humanitarian catastrophe. Ramyata, Limbu, Jazeera, Kathmandu.